Welcome everybody who's starting to join. I see we're about a minute out from 12. So we're going to probably start right on time as we've got a jam-packed hour coming up. So thank you for being here today, and we'll probably start in a couple minutes. Well, I see that we've got 12 o'clock and lots of people showing up. So we're going to start the presentation today. Wow, so many great upcoming sessions that we've got through the Office of Lifelong Learning and the Physician Learning Program. If you missed an opportunity or need more information on anything you saw, please take a look at our website for more details and information. I'd like to just say good afternoon and thank you for choosing to be here today, and welcome to session 1 of Following the Spark, our series where we will be discussing actionable strategies to untangle the complexities of autism and other neurodevelopmental disorders. In this first session of the series, we will be discussing ways to really recognize, diagnose, and care for autistic individuals living and other individuals living with neurodevelopmental disorders. These sessions are hosted by the Office of Lifelong Learning and the Physician Learning Program at the University of Alberta in collaboration with the Department of Psychiatry and Prisma Research Group, Precision Medicine and Autism. The PLP creates actionable clinical information by engaging with physicians, teams, partners, and patients to co-create sustainable solutions to advance practice. The PLP is dedicated to moving evidence into practice and fostering a culture and environment where everyone works together to tackle our most pressing problems, advancing patient care, and create a world-class sustainable health system, which includes important topics such as the ones today. My name is Karen Kelm, and I'm a research assistant with the Knowledge Translation team here at the Physician Learning Program. I have a Master's of Science in Medical Sciences with a focus in pediatrics, and I had the privilege of engaging with, advocating for, and supporting individuals and families with complex needs over the past 20 years. My work is inspired by these individuals and the many valuable partners in the communities of health, research, social services, education, and policy. As we look to our past, our present, and future, we acknowledge that we are on traditional territories across Canada, the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. And before we begin the session, I'd like to zip through a couple of housekeeping notes. So the use of the chat feature, please use that if you have any questions about technical difficulties or our programs and services. If you have any questions for the speakers, please use the Q&A feature of the webinar. And we can't necessarily guarantee that we'll be able to target all the questions or respond to any of them, but we will do our best as we go along. And thank you to Melanie Hetherington, who will be assisting us in the background today and monitoring that chat. Thank you so much, Melanie. A recording of this webinar and a PEARLS document will be sent out to anyone who's registered for the service. Main Pro Plus participants may earn certificates, certified credits for completing a linking learning exercise. MOC and Main Pro Plus credits can be earned by completing a professional development activity using my L3 Plan tool. So please scan the QR code for more information. This activity has not been formally reviewed by the CFPC or the Royal College. However, it is eligible for non-certified credits. I'd also like to make a quick statement and to address language. The Office of Lifelong Learning and the Physician Learning Program promotes an understanding, respect, and inclusivity in discussions about autism and other neurodevelopmental disabilities. We embrace a person-first language, recognizing diverse experiences. Our goals is an inclusive environment where everyone feels valued, acknowledged, and each person's uniqueness and strength. We encourage open dialogue, empathy, and continuous learning to reflect the dignity and the worth of individuals affected by neurodevelopmental differences. So thank you everyone for your time and choosing to be here today. The registration numbers truly represent a strong reflection of a community wanting to champion those with neurodiverse needs. And on that note, I just want to thank you all for being here. And it's truly my honor to introduce our first speaker today, and that would be Dr. Lonnie Zwaigenbaum. Lonnie is a developmental pediatrician at the Glenrose Rehabilitation Hospital, where he directs the Autism Research Center. He is a professor in the Department of Pediatrics at the University of Alberta and is supported by the Stollery Hospital Foundation Chair in Autism. He is the medical lead for the infant and preschool assessment services and neurodevelopmental assessment and consultation services at the Glenrose Rehabilitation Hospital, and the Edmonton Zone Clinical Department Head for Child Health at Alberta Health Services. His current research focuses on improving early detection and timely diagnosis and healthcare related to autism. Well, that's a mouthful, but Lonnie, I just can't thank you enough for being here, and I'm excited to see where things go. So thank you.
Oh, well, thank you, Karen. I'm really delighted to be co-presenting with you today. It's such a treat, and I really appreciate the opportunity to participate in this this great session. So let's go ahead. And welcome everyone, and thanks for taking time to participate and talk about these issues. So I think this is a good theme to launch this series. It does take a community. We can do so much more working together than we can sort of individually. And what I hope to cover today is just some examples of how through collaboration we can improve care for people with autism as well as other neurodevelopmental conditions. Next slide, please. All right, just a brief acknowledgement, no industry funding, and Karen commented on my clinical administrative roles, and I'm really fortunate to have worked with a number of colleagues as well as people with lived experience that have shaped some of the ideas that I'll share today. Thanks. Next slide. So my talk will, the content will focus on autism, but I hope that the principles will really be much more broadly applicable to folks with other neurodevelopmental conditions. I just want to make the point here that autism is not a rare condition. I mean, I went to medical school in the 1980s, and we learned like 4 in 10,000, and now it's 2% of the total population. So our kids will have autistic classmates. We will work alongside with autistic colleagues. So, you know, autism, rather than being a rare condition, it really characterizes a segment of Canadian society, and like other individuals with neurodevelopmental differences have very similar healthcare needs, the breadth and the need for access and patient-centered care that all of us do. There's no question that the number of specialists in this area have not kept pace with the increased rates, so we really need to think about how we can work together. And although we used to think about autism as a childhood condition, really autistic children grow up to be autistic adults and continue to have health and broader personal needs. Next slide. So I'll talk a little bit about the early signs of autism, and certainly some of the features of autism overlap with that of other neurodevelopmental conditions. I'll spend more time about how we can be working together more collaboratively and thinking about centering autism care within the patient's medical home, and the important role of community physicians and other community professionals. And although I'll touch on this, Karen will really elaborate further on the importance and strategies to champion neurodiverse people and families through their healthcare journeys. And but that third point is definitely an important guide for what I have to say as well. And I think if we keep the focus on the folks that we're trying to serve, I think that that our medical strategies will follow along. Next slide. So some of the ideas that I'll be presenting here come from the Canadian Pediatric Society guidelines that, although are focused on children and youth, I think have some relevance for autism across the lifespan. A number of professional groups, as well as parents, others with lived experience, and advocacy groups came together to formulate some practice statements around the range of healthcare needs. I'll touch on content from each of the three statements, which focused on early detection, diagnostic assessment, and ongoing care, and we'll make sure to include the link to the detailed text of the statements. Thanks. Next slide. So in terms of early detection, we recognize that autism is not the only thing that community professionals have to watch for, and monitoring for early signs of autism is intended to take place as part of broader or more general developmental surveillance, kind of looking at neurodiversity and developmental difference across the age span. When early features are identified, and I'll give some examples in a moment, we shift to autism-focused surveillance, which may include the use of specific questionnaires and other tools that in some jurisdictions are used strictly for screening, but what's recommended in Canada is really using them to inform overall clinical judgment around who needs an additional assessment. And then kids who are identified as being at higher likelihood of autism move to diagnostic assessment. As I'll comment on, that could take place within the same physician's office as who's providing the surveillance. And critically, we need to ensure that children and families are having access to supports and services at every step along the way, and then we're not holding off on a definitive diagnosis, and making sure that when we identify a functional concern, kids aren't talking, kids aren't engaging, that we connect them with early intervention services and increasingly specialized services. Next slide. So in terms of some of the early features, we've learned a lot over the years. Probably the best source of information comes from parents reflecting on their experiences with their children early in life. I've also been part of a research program monitoring younger siblings of children with autism. So looking at, for knowing that there's a higher rate of autism among those younger siblings, having the opportunity to see some of those features as they emerge early in life. So these are some of the earliest signs that are listed here. And, knowing that autism is a condition that is defined by social communication differences and preferences around play activities, sensory differences, sometimes a focus on intense or narrow interests, you'll see that these features kind of broadly map onto those areas. So around social communication, infants who go on to develop autism are more likely to not respond when their name is called. They may be quieter and not babble back and forth in as kind of reciprocal a way. They may show reduced eye contact even during infancy and during the toddler years. And even though they enjoy their time with their parents, they may not be able to communicate that enjoyment in the same way through directed smiles and other facial expressions. They may, even at an early stage, have difficulty transitioning between activities, get stuck on particular toys or activities, and also show intense sensory interest. So exploration of the environment by visually inspecting things, by sort of through their tactile senses, and just more attuned to the sensory environment and sometimes more distressed by the sensory environment than other children. Next slide. For a long time, we thought that if we could just nail down what the earliest signs were, that we could ensure that all children were being diagnosed at a really early age. But all of you know that simply has not been the case, that despite progress in learning about the early features of autism and recognizing that there are many children who go on to a diagnosis where there are clear features by 12 to 18 months, the average age of diagnosis is kind of stuck around 4 and 4.5 and hasn't really budged a whole lot in the past 10 or 20 years. So this notion that early detection leads to earlier diagnosis doesn't really pan out. And as you're aware, that's because the bottleneck isn't necessarily around recognizing the early signs, but navigating a complex clinical system, figuring out sort of who is going to see the child for diagnosis, and then having families wait on increasingly lengthy wait lists. Next slide. So we need to do something a bit more directly to ensure more timely and equitable access to diagnosis. And although we're framing this around early in life, I think that that principle could apply across life. And we know that autistic adults really struggle to find access to an appropriate assessment, especially through the publicly funded health system. So as I said earlier, the number of specialists is not keeping the pace with the number of autistic people that need care. And therefore, we need to actually work in partnership and develop multiple pathways to diagnosis so that we can increase access to diagnosis, and not only diagnosis, but also quality healthcare. Next slide. This is part of a broader shift, as I commented on, thinking about autism not as a rare condition that needs to be managed in a specialty clinic, but actually as a segment of Canadian society where there are universal healthcare needs, and appropriately, like other Canadians, those healthcare needs should be centered within the medical home. So really working to support family physicians, pediatricians, and other medical specialists in providing healthcare to autistic people, and that principle could be applied to all individuals with neurodiversity. Next slide. I won't go into it in a lot of detail here, but in terms of sort of building further on this metaphor, we can push things along to earlier diagnosis, but as I commented earlier, what we really need to achieve is a system that responds to the functional needs of infants, toddlers, and really people across the lifespan, so that people aren't stuck being closed out from diagnostic assessment, and as a result, don't get the supports and services that they need. We need a more functionally based system, and that it becomes a bit of an advocacy piece of the work that we do. Next slide. So in the Canadian Pediatric Society practice statements, it talked about the key elements of diagnosis. And again, this is anchored in autism, but arguably applies to other neurodiverse conditions. So we want to be clear about the correct diagnosis. We want to explore co-occurring conditions, both physical and mental health, that may overlap with autism, but may genuinely co-occur. We want to understand the individual in a more holistic way in terms of what their function, their strengths, their challenges, and interests. And we want to provide practical information about accessing supports and services that address that individual's needs. And we need to do it in a way that's timely, that's centered on the patient and family, and in a way that's culturally safe and acceptable. Now, none of that implies a particular health discipline. None of that implies a particular assessment measure that's used. It is really sort of a foundation for providing holistic assessment that I think increasingly we would argue could take place in multiple settings and involving a different range of professionals. Next slide. So therefore, the Canadian Pediatric Society and a number of other national bodies have recommended having multiple pathways to diagnosis. Broadly, this could be described as sort of individuals being assessed and diagnosed in the community, also and versus individuals being diagnosed by a specialty team, perhaps in a specialty center. But it's really important to keep in mind that this is really intended to be more of a continuum and a partnership rather than sort of siloed independent pathways. So while community physicians are prepared to assess children and might be more appropriate to start with kids with less kind of diagnostic complexities, so more evident features, perhaps less, perhaps sort of more obvious kind of developmental challenges. There are always going to be a group of children, no matter what setting they're seen, where an additional opinion is needed. So having the flexibility to move between streams and making sure the professionals in each stream are working together in close collaboration. And I'll talk later about sort of a formal platform to allow that case discussion to support sort of the independence and confidence of folks doing this kind of diagnostic work in the community. Next slide. We have about 10 or 15 years of experience of specialty teams working in partnerships with community physicians, specifically, particularly pediatricians. Where there's that partnership in place, the quality and the accuracy of the diagnosis taking place in the community is terrific. Melanie Penner and Meng-Shuang Lai recently reviewed this literature, really concluded that community training partnerships are an effective way to expand capacity community and are lead to positive experiences for families. They also note, kind of based on the data, that ruling out autism may require more expertise than ruling in. So I think for those of you that work in diagnostic practices, you'll recognize that when you see kids with sort of really clear features, often it leads to a confidence about the diagnosis. But where the features are a bit more subtle or ambiguous, it's hard to be certain. And I think that's where it requires a more flexible approach, and never closing the door on diagnosis. But that's not to suggest that therefore all such children need to move immediately to a specialty center, because even sort of across this diversity, community physicians can be very effective in their diagnostic work. Next slide. In Edmonton, we have a diagnostic model that adopts these principles. For a number of years, the team at the Glenrose has worked with a number of community pediatricians, including, I think, a few on the line. We're like really proud to have worked in partnership, and really grateful for the investment and expertise that these community professionals bring to this work. So it's a three-step process. The community pediatricians receive some initial training around not only diagnostic assessment, but practical information about how to support families through sharing the diagnosis, and then in providing information about accessing services. The next step is members of the specialty team. So a colleague and I actually spend time with the pediatricians in their offices, kind of seeing the first few children that they're seeing independently, to provide that sort of in the moment kind of coaching and support. And then at that stage, the pediatricians are seeing kids on their own, but are for the first several, and then sort of as needed, they present the kids that they are seeing to a group of their colleagues, as well as a few of us at the Glenrose, to have a chance to talk through some of the subtleties and and sort of remaining questions to further support the pediatricians in refining their own kind of diagnostic judgment to prepare them for independent practice in this area. And this ongoing case discussion really is not just between community and specialists, but kind of really genuinely creates a community of practice where colleagues are supporting one another. Next slide. I don't want to suggest that this is easy work, and particularly for those of you in community practice, this is a bit of a different kind of assessment. It's a bit more time consuming. The reports are longer. There's a bit of additional work in terms of reviewing files and generating reports that include information about supports and services. That's a lot of work to integrate into an already busy practice. And I want to acknowledge that our current context with a strained primary care system where many children and families can't even find a family physician, much less pediatrician. It's not easy work as a community physician. And I know a number of my community pediatric colleagues are needing to kind of stretch themselves to cover some of the primary care needs, for instance, kind of newborn coverage, and that makes it that much more difficult to incorporate yet another role. And yet they've provided a critical service that has helped Edmonton expand its diagnostic capacity despite these challenges. Next slide. How do we address these challenges? Well, it's there is a certain there's a certain time commitment to these assessments, but we can streamline things by working on shared report templates. I mean, now that within Alberta Health Services we've moved to Connect Care as an electronic health record, we can find ways of kind of using smart phrases and templates to streamline the reporting. Within practices, sort of working with other health professionals to support file review, to pre-populate the reports with some of the information can also kind of reduce the time. We also have to be cognizant that we don't want to disadvantage families in any way, depending on which diagnostic stream that they're going through. So we need to ensure that resources can be accessed by families, whether that's informational, workshops, online support groups, as well as kind of provincially funded services, regardless of where the diagnosis is received. This training and partnership is not a one-off kind of deal. It is really about ongoing collaboration and shared management. And part of that is through a particular community of practice model called ECHO that I'll speak about briefly in a moment. Next slide. I'll briefly talk about sort of ongoing healthcare. I mean, just to say that these are important examples, but truthfully, just about every physical health and emotional health condition is experienced more commonly among autistic children as well as among autistic adults. Next slide. And although there are particular nuances that that benefit from an understanding of the features and biology of autism, the truth is the general approach to assessing and managing the breadth of these physical and emotional health conditions applies to both non-autistic and autistic children. And one can make a similar comment for adulthood. So the truth is community physicians very much have the training, expertise, and experience needed to provide excellent health care for autistic people. I think where it becomes difficult is understanding sort of how to apply those skills to kind of the unique circumstances of someone with autism. You know, how the communication differences, how emotional health differences might sort of impact on health. But we can all work on this together, and there isn't a cookie cutter approach for autism, but rather taking into account sort of individual characteristics and needs. Next slide. And one way that we do this is through this particular continuing education program called ECHO. And the notion of ECHO is a partnership between specialty clinics and community professionals so that families can access excellent healthcare and individuals can access excellent healthcare, whether they happen to live in Edmonton next to the Glenrose or whether they live in a remote rural area where it's a town of 10,000 people, maybe not consistent access to a pediatrician, but very committed and invested community healthcare professionals who are supporting their families. And it comes originally from a study of adults with hepatitis C, and it was a clinical trial, and the short story is that by participating in this community of practice that involved discussing cases, adults that were managed by their community physicians hundreds of miles away from the specialty center had as positive outcomes as those that were coming directly to the center. Next slide, please. So broadly, this is, was my first exposure to Zoom. You know, it is essentially a sort of a telehealth-based platform. It's a little different than traditional telehealth, whereas, you know, rather than an individual clinician kind of patching in with a specialist to talk about kind of just their own patient. In fact, it's a community. It's a large number of professionals coming together, sometimes as many as is on this session today. One of the community participants presents on a patient that they're seeing. They're supported through clarifying questions and recommendations by their colleagues who are also participating, and the session is facilitated by a group of specialists who contribute their own expertise. So there's this collective process of sharing expertise and over time, community professionals feel empowered and confident to be able to manage these complex issues more independently. Next slide.
Lonnie, I'm just going to ask you a quick question while it's in the chat and we're on this slide.
Please.
Is ECHO also in Calgary?
It is. So our current ECHO is provincial. So we have a number of people participating from Calgary. I'm also aware that there is an ECHO not for autism, but for actually another condition kind of that's been ongoing for a number of years. And also that that I have colleagues in Calgary that are looking at sort of launching sort of a more of a Calgary-centered ECHO. But currently, our ECHO autism is actually provincial. So we've opened it up to folks from across the province.
Excellent, thank you.
Thank you. So just a quick shout out to my colleagues. We have a wonderful, what we call a hub team. So kind of the specialty team comes together, but I really want to emphasize that specialty it respects both professional expertise, but also lived expertise. So we have representative from Autism Edmonton, who is also a parent who is extremely knowledgeable about community resources. We have a parent of an autistic adult who works at the Glenrose and shares her experience and also kind of her knowledge of the system. And we have we actually have an autistic adult as well who kind of shares his perspective, even though it's a pediatric focus. And then also people from different disciplines, including OT and psychology. Next slide. Um, our ECHO is supported by the Autism Care Network. I just wanted to give them a quick shout out because they have a number of excellent online resources that are quite helpful in terms of supporting families as well as colleagues in managing common physical and emotional health conditions. These are available by free download. Most of them were co-developed by parents and healthcare professionals. So a lot of good practical advice and visuals, and we'll make sure that you have the link to these toolkits. Next slide. Yep, there we go. Karen will talk about this more in depth, but as we really think about autism as really characterizing a group of Canadians, and we think about healthcare, it's not only about treating their coughs or their ADHD, it's really about sort of health in a more holistic sense. And the determinants of health for autistic people are really quite similar as determinants universally. This F words comes, is the inspiration of Jan Willem Gorder and Peter Rosenbaum at Canchild, and really speaks to the importance of thinking about the ICF model of function, but translating it down, when it comes down to it, what makes us healthy, what makes us look forward to getting up every morning. It's our families, it's opportunity for physical health and recreation, it's our friends and social networks, it's the things that we look forward to for fun and sort of that draw into our interests, and it's that hope and optimism for the future and opportunities for the future and supporting our function along the way. Next slide. So ultimately, kind of what can we do to support autistic people and their families, and more broadly, neurodiverse people and their families? Well, as individual clinicians, we need to bring our humanity. We need to approach this from a place of compassion, to be respectful and recognize cultural diversity, and not recognize cultural diversity in a prescriptive way, but from a sense of curiosity and always asking sort of what the meaning of the experience from the perspective of the family and their culture. It's a focus on strengths and hope, which I know that Karen will speak about more specifically. No matter how much we learn about a particular condition, it's always bringing it down to the level of the individual and family and understanding their specific goals and priorities so that we can focus our support and care accordingly. It's not a trivial issue. It's about having a welcoming office environment. So for autistic people, this may be further attention to the sensory environment, but it is certainly also attention to kind of our respectful communication and being aware that everyone kind of listens and communicates in a different way. Continuity of care is essential as well, and that's where the medical home becomes so important. And as I commented on in terms of kind of more of a function-based service system, no matter what we're doing with individuals and families, kind of thinking about how we can advocate and participate in system change. And next slide. And that is it. So I'll just kind of acknowledge sort of my many partners, wonderful people in my research center, and huge thanks to folks in the community as well as at the Glenrose for our community partnership. And with that, I'll turn it over to Karen.
Thank you, Lonnie. You did it. 25 minutes. I'm impressed. I know you, as myself, are so passionate about this topic and could really talk for hours and days on this. And I think it's a beginning of a conversation and, an opportunity to build community and collaboration. It's exactly what we're doing. So thank you so much for those insights and sharing your wisdom with us. Now we're going to take a little bit of a twist in this session, and we're going to kind of look at a case study with a twist through the lens of a family. And the goal of this is to help you understand one's family's real world experience, and hoping that this narrative will really deepen your understanding of how intricate the situations are that families face and what they encounter when navigating the complexities and the multitude of services and support from birth to adult years. So we will be using menti.com for a little bit of interactive session after our case study. So if you have an opportunity to flip up a second screen or get your phones ready, so once we go through this case study, we can have those conversations for that. So this case study begins with a young couple who are just excited to really share their lives with a tiny human. And, both these individuals, post-secondary education, no known health concerns, and this couple decided in their mid-20s to have a child. So as we look from birth to adult years, this little guy came along, and he was born to term, slept well, had a great appetite, hitting his milestones with a great, happy personality. The parents had basic health knowledge and followed the healthcare guidelines for checkups and immunizations, and the family was quite engaged within the community, getting their child out, and playgroups and everything like that. So as we look to the next 6 months to a year, the parents began to notice some slight delays in development in comparison to the children around them. These included sitting and up until one, walking and talking. Not having a background in child development or being familiar with gross motor development, they just thought their child was clumsy and kind of was being goofy, I guess you could say. Additionally, they began to notice that he wasn't picking up his Cheerios with his thumb and forefinger. And again, not familiar with fine motor skills, but brought it up with the family physician at the 1-year checkup. The parents began to access and learn resources, develop games and materials, as well as increasing their knowledge on child development by reading any sort of resources that they could get a hold of. And I will state that as we're looking at the development from birth to this child is now 21, we were looking at the back of dial-up. And a lack of social media and an ability to interact. So it was a little bit different than what parents experience now. As we move into the preschool years, the parents continue to see the child struggle to function within a typical manner at home and in social environments. As such, the parents continue to engage and access more healthcare supports. We can see that the functioning challenges continue to grow, and as such, the behaviors including separation anxiety, tantrum, screaming, yelling, destroying property became more frequent. The child received referrals to specialists, which adds to the list of healthcare providers, and this includes having evaluations and genetic testing done. So during this process, the family also started accessing multiple social supports, as you can see, and on many occasions, accessing public supports were delayed due to wait lists, and the parents decided to seek private services, believing that they were kind of in an essential development year for their child, and they wanted to provide every opportunity possible. So the family ended up getting a behavioral diagnosis of autism spectrum disorder, and this opened the door to some services such as specialized services or specialized preschools, which offered the PUF program, which is program unit funding, and support and services to access speech and OT and other interventions. So this family also accessed FSCD, which is Family Support for Children with Disabilities. And while these financial supports are valuable to families, they create quite a tremendous load for families as well. So not only do they have to find providers, but by signing a contract with FSCD, they're legally responsible to manage funds, balance payroll. They have to, if they're using their own services, they have to advance funds ahead of time before they get reimbursed, creating kind of a financial strain for families as well. There are some organizations that offer direct billing to FSCD, but space is limited and it can get quite challenging. Around the age of 3.5, after the autism diagnosis, the family was also informed that the child, genetic results were back, and the child was diagnosed with Fragile X syndrome. So as we move into the elementary years, there became more challenges. And as you can see, functional challenges, access to healthcare supports, as well as community sports continued to increase as well. Mom continued to stay home and found other options for income so that she could help support the family, but also so that she could stay home and work on therapy goals with the child, try and develop friendships with peers. And in addition, they found that public supports were sporadic and limited. So the family continued to work both with private funded services and public funded services. As we continue on and we look into junior high, the list continues to grow for this family. And as we can see and know, families experience some highs and they experience some lows. The disconnected system of care resulted in many repetitive conversations across these silos of support. And the parents also had to continue navigating and coordinating across these complex systems, kind of finding out what place they are in and how to get access to these services. They were constantly trying to ensure that the right people were at the right table, having the right conversation to support their child, as well as trying to coordinate the child's care across the health system, including education, social supports, community supports, and more. Needless to say, this family is exhausted and struggling. However, something happened. The parents began to see a change. So when we talk about functioning, the child all of a sudden started connecting within their environment. Now, this is where we're going to start getting into the menti.com. So if you can take a second and log on to menti.com and use the code below. And I want you to try and think about, what do you think contributed or was the catalyst for this change? So this child ended up engaging more with their community. The child was excited to be around other people. The behaviors were less severe and he became kind of a joy. So I'm going to take a moment here and switch over here and ask you, what makes you think that, what do you think was the catalyst for change for this kiddo? A sense of community. I love that that's the first one that came up. So thank you for putting that one in. What else do you think might have caused all of these opportunities for this child to be successful, be happy, want to go to school? Oh, this is wonderful. I absolutely love that this is where this is going. Whoops. We'll get back to there one sec. Friends, acceptance, feeling of connectedness. Well, I almost feel like we don't need to do this presentation. If you all know this, this is fabulous. A sense of belonging, his strengths, strengths-based counseling, absolutely. Support from parents, being part of a community, absolutely. This could keep growing. And we could be here forever, and I'd want to keep seeing all of these, but we should probably continue on. So we're going to pop back over here. And you know what, you guys nailed it. I was hoping to surprise you, but that's exactly what it was, is there was this sense of purpose and belonging. This individual felt as though he belonged to a community. He found a love for sports. He wore a jersey with pride, and the family used to think that he didn't have an ability to communicate in a language base. But when he found purpose and belonging in that jersey and sports, he found a reason to communicate. So what can you do with this knowledge to support families going forward? So the main thing here, and as most of you pointed out, is that we need to follow the spark. We need to know what is making these kiddos smile. And it's so unique for everyone, but there's so many different ways that you can find it. So as Lonnie had mentioned earlier, making a clinic, comfortable for people to be a part of. And it's hard to have those communication, that time to communicate with individuals and ask questions, but there's hints. Are they wearing a jersey? Do they have a favorite shirt on? Are they wearing a music band? All of these opportunities to find strengths and assets of individuals to help build the conversation. Create activities where, based upon what the individual is excited about. So if they're in school, they're counting beach balls or sailboats or coloring them, are we going to get meaning out of that? But if we look at something like a jersey, there's so many things that we can get out of a jersey. We've got names, we got numbers out of a jersey. We can find out who won the game last night, add the scores. And there's so many things that we can do to support office visits, to support therapies and educational interventions when it's within the framework of what the individual is important to them. And one of the main things that we have to look at is ask the parents in a meaningful way, how are they doing? And I'm going to share with you, and some of you may already know, that this case study was actually my son. This is Noah, and Noah is now 21, and we struggled so many years. But he's such a joy in our lives. And, I think we don't sometimes see what that end is going to be, but we know that there's so many successes that we can have. And it gets better. It gets so much better, especially when we find that spark. But we have to acknowledge how important it is for parents to be their best selves. We know that that relationship between parents and child is so significant in development, and we need to help create that strong relationship. And that's by supporting the needs of parents and trying as much as we can to lessen the load that they carry and be their champion and help them have that best relationship they can with their child. So as we look at time and as it goes, parents do become experts in the care of their child. They're navigating the system, they're translating information into what they found into their unique needs, and they implement what they see: resources, supports, educational material, funding opportunities. How can they use that within their environment? All for that end goal of meaningful and active participation in life. And draw upon that. If you have people within your practice, if you talk to people, ask them what's succeeding and what's helping you succeed. And that's also going to help you find resources within your community and how you can work around that. And this kind of brings us back to the F words of disability, as Lonnie was talking about. And in kind of looking at time and wanting to ensure that we have a time to answer questions and everything, I won't go into too much detail, but we can see how along the way, and as you all pointed out in our survey, that it's these important things like friendships and family and fun and really hoping for a future that helps develop that sense of belonging and joy. And so when we look at person and family-centered care, we need to really also acknowledge the amount of work that goes in and understand that this is an infinite and complex, uncertain journey that individuals face. And it's not a linear process. And so families aren't, waiting for a diagnosis to then get supports. As they're waiting for a diagnosis, they're also doing other things on the sides to hopefully see that meaningful and active participation in life. And it's so important to understand things like words matter. And so I say have here that it's not a transition to adulthood. And what I mean by that is a great friend of mine once pointed out to me how a transition to adulthood, where the word kind of insinuates that the care from childhood to adulthood is, a period of transition where we change from one to another. And it's quite the opposite. So when you get into that childhood services and adult services, one stops and the other begins. And unless a parent is informed about, putting in applications early, and we all know about wait times right now, that a lot of times families have to start that transition from about 16 years old to adult years. And that's getting things like guardianship and trusteeship in place, bank accounts in place, maybe psychological assessments, so they have an updated assessment, but we can get into all of that later. But it's a lot of work, and we really need to communicate ways or how things are working so they're very clear to parents that it isn't a transition where one automatically starts when one ends. And this kind of brings us back also to that patient's medical home and, how important this is to families. And while we're accessing many other different resources and supports, the patient's medical home, that primary care, is that one consistency for individuals across the lifespan. It's not just once we have kids have a diagnosis that it changes, but they will be needing care for the rest of their lives. And how can we make it person and family-centered care by drawing upon those strengths and supporting families? But not only is the patient's medical home significant, it's also significant that we recognize those communities of champions for both families and healthcare providers, because all the information that Lonnie shared and all the information here, we really understand we can't do this alone, and we all have to do it together and build those communities of practice and support to champion both families and healthcare providers. And we know that family physicians have so much on their plate, and specialists, allied healthcare providers. And many of you are in this because it's in your heart and it's your passion. And I'm sure it's difficult to see the challenges and the struggles that so many people face because of wait lists and long lines, but we can all work on this together. So in preparing for this, I had dreams of putting together a full list of resources and support, especially kind of in that Edmonton area and surrounding areas. And to be quite honest with you, even navigating the system for over 20 years, I was overwhelmed. And I was also finding new things that had either just come out or been around for a while and I didn't even know about. Child disability tax credits, RDSPs, FSCD. I actually just learned, which is an important point, that FSCD now has a small little package that families can access who don't have a diagnosis yet. So you don't have to wait for a diagnosis to get into FSCD supports. And I could go on and on about, this wealth of information that's out there to support families, but sometimes the problem is navigating all those supports, as I'm sure you know. And so that's where organizations like Autism Edmonton and Gateway are there really to be your champion too. You don't need to know all this information. We have resources like themselves who can help families be guided through these processes. All that to be said, in hoping that we have some conversations after this, because I know sometimes there's lots of questions and sometimes some of those meaningful conversations happen afterwards. And this was kind of the premise behind my thesis and how powerful I think strengths and assets are, but is also really recognizing everyone that's involved in care for autism, neurodevelopmental challenges, or anything within the community, is really acknowledging the individual, the parent or caregiver, and the community around them. And we need to champion everyone around there. So as we look for a quick review about what we talked about today, we talked about ways to recognize signs of autism and other neurodevelopmental disorders, but like I said, we need to really build communities and champions for one another to be successful in everything we do, because we all do carry quite a load in supporting individuals to achieve their best selves. And really, let's take the time to help individuals and families create a place of belonging and purpose. And don't forget, a child doesn't walk into the doctor's office when they're 1 year old and say, hey, I'm delayed in my development. That's the parent that recognized those delays and is working their butts off to really ensure that they are able to access as many supports and resources as possible. And as much as this was a quick little chat and we talked as fast as we could so that we had time to talk, please feel free to reach out to Lonnie or myself with any other questions if we didn't get to them here today. And so one last quick thing we do before we get to questions is we do very much value your feedback, as it helps us at the Physician Learning Program and Office of Lifelong Learning to improve the quality and education programs that we offer. So if you could take a couple of minutes to fill out this to help us meet your needs. It should take no more than 5 minutes. And as a thank you, you will also receive an opportunity to participate in a raffle for a $10 Starbucks card, which will close 1 week from today. So taking a quick snapshot, we'll throw this up at the end as well. And of course, I'm going to put in a little plug for the rest of the session. So if you haven't registered and would love to continue this conversation, I see some people that have attended that we're going to be talking about the adult side, as well as precision medicine after a behavioral diagnosis, and celebrating Rare Disease Day next Thursday. So I'm going to do a quick little stop sharing. And it's so great to see faces instead of slideshows, but thank you so much, everyone, for your time. I'm going to pop up the question and answer as we talk here. And thank you, everyone, for your comments. And I've got here, lots of parents blame themselves for their child's diagnosis. How can I help them understand that their child's autism diagnosis is not their fault? Lonnie, I'm going to have you start with that one if you.
Great, thank you. So a couple of thoughts come to mind. I mean, first is kind of taking inspiration from your presentation, Karen. I mean, ask parents like what their theories are. Like if you're concerned that they may be blaming themselves, actually kind of ask their understanding of autism, and if there's something specifically that they're worried about, and bring that to the surface can help kind of talk that through and clarify, sort of, because there are certain things that people believe cause autism that do not. I think the other really important layer, and I want to acknowledge that clearly medical investigation, including a genetic workup, can also shed light on etiology and can also help mitigate those kinds of concerns. I also think that making sure that we're not approaching the diagnosis as breaking bad news. So I think many autistic people kind of really push back at that tragedy narrative about sort of what a devastating condition this is to have. And I do think that if we can talk about autism not only as a medical diagnosis, but also as difference in neurodiversity, and sort of talk about strengths and opportunity and the range of difference that's associated with it, I think that can help reframe it. So this is not sort of bad news for someone to kind of find necessarily a reason for, but rather acknowledging the unique aspects of the child and working in a practical way to support that child to thrive and pursue their spark, as you're saying, Karen.
Thank you so much, Lonnie. I think, in that question, as well as the one below where, what may have been helpful to know as a parent earlier, I would say kind of, in looking backwards for me, I got so caught up on those rote tasks of, my child has, some sort of difficulty or is unable to function within their environment. How can I fix this? And not so much in a fix this, but, I'll put him in speech, I'll put him in OT, I'll do all of these things. that we really forget about how significant that relationship is between parent and child. So for my advice, I would say to you is just to say to parents that the most important thing is to develop a strong relationship with your child, and everything else comes as it comes. And we have so many resources available right now where if the child's struggling in reading, but friendships are so important, then we have voice to text and text to voice. So there's many options out there to create that sense of inclusion and belonging. So I'd say work on the parent-child relationship and relationships within the community. I think when someone feels as though they belong somewhere and they feel like there's purpose in their life, then they're actually more drawn to learn more and engage more with their community and have them be advocates for them as well. How can people join an ECHO?
I am just posting that. So we're still working on sort of a kind of a sustainable plan to support it, but I'm hopeful that we can continue to offer it 2-3 times a year. And I just commented because that person happened to be anonymous, that that if we have their contact information, we can make sure that the person who coordinates it can let them know when registration is open again. And likewise for other healthcare professionals on the line, if you're interested, we'll we do it is an open registration process, and we'll make sure to share that broadly.
Excellent. And we have a great comment in here about genetic testing should always be a part of the diagnostic process. And Kim, thank you for sharing that. I know we have Dr. Daniel Moreno DeLuca here, and that's actually going to be a part of our conversation next week. And so you're not the only one that feels that way, and we'll definitely be talking about that next week as well. So I do realize that it is 1 o'clock. I do apologize we couldn't get it to any of the all of the questions. We will look into the slides and sharing. We'll talk to all the presenters about that. Please know you will get a recording of the session, and we will also be sending out some PEARLS documents. So once again, thank you everyone for attending. We really appreciate your time. I'm going to take this last little minute to just remind you, if you have a second, if you could please, well, first of all, attend the sessions next week. If you haven't registered, there is still space, and we would definitely love your feedback and everything there. But again, please don't hesitate to reach out to myself or Lonnie with any questions that you have, or join us for session 4 when we can have a little bit more time with the panel interview. So thank you once again. And I think that's everything for this week. So we appreciate your time, and thank you.